Some of the greatest dangers in healthcare are invisible. Today, Group H demonstrates how simple precautions can make a difference between infection and prevention. Number 1. Damp dusting.
First of all, you should know what is damp dusting. That is cleaning areas which are frequently touched in the hospital.
As you can see, she's ready with her water, her soap, her basin, her 2 buckets down, one for clean water and the other for pouring dirty water. As you do that, make sure you've hand gloved, you've worn your mask and your hair is properly protected.
With one side.
As you have seen, she has cleaned from the clean surface to the dirty surface. Make sure you clean thoroughly. Remember, damp dusting is a method of cleaning, simply removing microorganisms from the surfaces, and then hand washing. As you can see, our nurse is first protecting herself. You open the tap properly. You wet till the elbow. As you can see, then you apply your soap. Make sure you perform all the steps properly. After that, you rinse. As you rinse, make sure that after rinsing, you keep your hands raised just like that. And then dry using a towel. And you make sure that you use one edge at a time. And then in the end, you close the tap using a towel. Next is sterile gloving. For sterile gloving, as you see our nurse, you have to first make sure that your pack is safe. Confirm the expiry date. Check your size, make sure it is packed properly and sealed. As you put it down, make sure you've provided a sterile field. And then, as you open it like that, make sure you do not touch the part that is going to touch the patient. You begin with the dominant hand first, just like that. Since the other is safe, you don the non-dominant. You organize yourself, raise your hands, cross them and wait for the next procedure. Next, waste segregation. As you see, the nurse is ready. She's explaining the different types of wastes found in hospitals, where we have the infectious that are disposed in the red bin, domestic, papers. Domestic waste is non-infectious, straight to the black bin. And then we have the pharmaceutical waste, expired drugs, syringes, bottle of injection in case it's expired, straight to the brown bin. Finally, the sharps. And those ones are always disposed in the sharps container. As you handle your waste, make sure you're very careful. Dispose properly in the bin, just like that. And then the infectious wastes, the ones that have sold blood, they have touched the patient, straight to the red bin. The pharmaceutical waste, straight to the brown bin. That was a cannula to the red bin, expired jugs to the brown bin. Finally, wastes are safe when disposed in the right bins, just like that. The next procedure for bucket system. As you can see, our nurse is ready for the decontamination. You have to first get ready. As you can see, she's first dressing up in her personal protective equipment, her mask, shield, her gloves.
We begin with the first bucket. This has soapy water. The second one contains clean water. Then the third one will have our mixture of jik and clean water. Then the last one will have clean water. So our desired amount for jik is a concentration of 0.5. So now to get the parts of water to add, we base on the concentration of the jik that we are going to use. As you can see, this is 3.5 concentration. So we shall divide it by our desired concentration, that is 0.5 minus 1, giving us 6 parts.
After measuring and getting the parts of water, as you can see, after measuring just like that, you add 6 of them basing on the desired concentration of jik, which is 0.5. After you start cleaning, make sure you clean thoroughly like how she's doing it. You make sure you leave the equipment in jik for about 5 minutes, and then you spread them to dry after the equipment are taken to the autoclave. Next, preparation of the stir-fry pack.
I have a receiver, I have 3 gallipots here, I have a grape, and I have forceps. All these instruments are things that we put in a sterile pack. So we have two sheets here where we are going to wrap the instrument. So I begin with laying one sheet on a table, of course a clean table, because we don't want any kind of microorganisms when you are back. After this sheet, I'll put on another.
As you can see, she's going to use 2 sheets. That's a drip. And then the gallipots, just like that. The kidney dish, and then the forceps. After that, you start folding. Leave that corner. After folding, you tie. Just like that. After tying, you label for easy identification. Thank you so much for watching Group H.